is to make sure to keep people out of hospital that don't need to be in hospital yet. And therefore make sure that our intensive care beds are still vacant to the really bad cases, and also our normal day beds in the hospital. And we were very successful by doing so. This was one of the aids we had to make sure that our hospital capacities weren't overwhelmed. One of the, what we actually deployed this thing within 10 days. So we developed it, we integrated it integrated it into the epidemic system, and also did our security check and our data security check within 10 days. So this is not normal. 10 days is a little short for something like that. And one experience that we made, and maybe we are the only city in the whole world that has done this experience. If you look at the whole Corona process and how many different players are involved and how many different systems are involved, some of them being systems of the city administration itself, but also like from laboratories, systems outside the city administration infrastructure. But the state of digitization on a scale of 1 to 10 may be somewhere around 2.5, meaning that most of the systems don't talk to each other. So, but Corona, with all its dramatic aspects to society and health and economy, what Corona does with digitization is show the management, the city management, how much more effort needs to be taken to really talk about digitization, because most of the systems are not integrated. We don't have any integrated systems. Data isn't flowing from one system to the other, and we have interruptions all the way long. We have like 10 or 12 players, 10 or 12 systems, and we needed to integrate those systems during the last 6 weeks, and we're still not finished. And this is only one process. So this is a very, very hard, but very, very important lesson that we learned alongside with Corona. Yeah, so that is on the one side, our experience with home care as such, but also in respect to the process, to the whole process around Corona.
So, questions or comments to Robin? Should I start? I start. So, Robin, what is there to share with others? I mean, I know that you haven't got any time to write down documentation or whatever. Don't worry about it. But my question is, for instance, are you sharing those what you have developed with other cities in Austria? If yes, how does it work, and how could it be used by others if ever they are interested?
We have offered it to all the other states and cities, and again, it's a question of integration work. We would share the home care web app. It's not an app; it's a web app. We would share the web app. Whoever would like to have it. But whoever takes it needs to know that it needs to be integrated in their epidemic system. And I guess everybody has a different epidemic system. So you need to connect it to your epidemic system. Otherwise, you have no possibility. This web app is of no worth if you have a PDF or a CSV or an Excel as an output. The data needs to flow directly into the backend system in order to be of real value. So it's a 50-50 answer, the same answer we gave to the other states, and we have 2 states that are going the way of integrating it. At least that was my last information. We will happily give it away but whoever wants to take it needs to know that it needs to be integrated in the epidemic system.
Robin, this is Lars. I have a question. Last time I tried to get some more information, but we couldn't get a connection.
Oh, yeah.
And today I connected to our conference some minutes too late, so I couldn't hear all your report. Some words about situation in Leipzig. We have been asked for an application, but not an app, from the department for heels of the city of Leipzig, and we did it as an additional application based on Lotus Notes. But this we couldn't bring to other administrations, for example, in Saxony. Now we are checking if we will make a totally new application within maybe 3 or 4 months, and it would be very interesting to integrate this kind of work you have done in Vienna. And this time I check if there are interested administrations in Thuringe, in Saxony, and in Brandenburg to start a talk about. I would come back to you in this case.
Yes. You're welcome. You're very welcome. I forgot that we tried to connect and didn't succeed, and then it somehow dropped off my desk. I'm sorry about that, Lars.
No problem. No problem.
Paolo, I think you wanted to say something.
My simple question was concerning the role of IT in such a kind of crisis from the point of view of social services. What I would like to know is which kind of strange request or which kind of particular offer you did to your colleague working in the office for social service as IT in this particular crisis that you would like to outline, to discuss, to put in the table in this discussion, because it is a period where we are working as normal, so with our service, but with something abnormal and particular. So which has been the role in Vienna about that? Something positive, something negative?
Right from the start, department number 1, which is the IT of the municipality of Vienna, was part of the crisis team of the city of Vienna. So the deputy city director asked us to be a fixed member of the crisis team, which was end of February. I was just at my mother's-in-law having coffee, and the phone rang at 3 o'clock in the afternoon, and I was asked whether I could come immediately. They have something very important to talk to. So we were involved right from the beginning. And actually today we got a letter from the deputy director of the city administration thanking the IT for all the support, because whatever we did in the last 6 weeks needed the IT, and thankfully the director realized that it is that way. So our role at the moment is, I would say, if you look at digitization at the moment, is the way it should be all the time. They have realized there is no way to go without IT. The good thing about it is that they also realized, one of my first sentences was, please, you have to accept that we are not able to repair within 3 days what we haven't done for the last 10 years. It's impossible. So yes, we are heard at the moment more than ever before.
Robin, I have another question. I got a suggestion from a common friend of ours, which is Isabella Mother,
Yeah.
and she was suggesting to me, why don't you share among cities the way to share the bunch of common data which is available for the coronavirus at region, or sometimes at countries, at government, yes, but region, but not at city level, and try to find a way to share, let's say, methodologies to manage this data and so on. So from what I understand, behind what you said, there is a lot about data, right?
There's a lot about data. There's a lot about interfaces. So at first, having data that is generated at some point in the process and finds its way through to the one central system that is the basis of all decisions that the government takes. And on the other hand, the data itself. We're working on dashboards. We're working on getting data from various ends of the city to match them and do some contact tracing and finding out whether we have some infection chains and some areas in the city that are especially infectious, if you allow me to say that, to use that term. That is, by the way, what we are having to deploy tomorrow, as our shops are opening or have started to open, and everything is open by Monday. And sharing, I have always said it's crazy that Vienna does the same thing as Linz, as Salzburg, and then as Rome and as Helsinki and whoever else. It's a pan-European challenge, and we are all tackling the exact same problem, and everybody has to do it on its own. Yes, I agree. We need to share data. We need to share experience. It's a European challenge, but bear in mind that every municipality will have different data models, will have different services up and running, will have different databases, central systems. So getting those, and again, we're talking about the big data stuff, getting those into a data model, into a data set, which everybody has agreed on, so we can actually really share the data amongst each other, is the big challenge, I guess.
So this is not something. So this is something that is the base, and it won't happen just because we make a discussion among us, right?
Right. And even if Vienna, for example, would donate all the data, Rome would probably have little value out of it.
Mm-hmm. So does it make sense? Does it make sense that we have a different, not today, different discussion about this?
Yes.
Yes.
What you do need is some kind of central platform with standardized interfaces, and all the municipalities that want to participate just feed their data into via that standardized interface.
And develop management tools to take decisions and so on. Okay, thank you very much. I'm sorry that you are leaving, but if you want to stay, please stay.
I may come back, but I need to go right now.
Or if you come back, we will be pleased.
I'm sorry about that. If I don't come back, have a nice afternoon. Thank you very much.
Thank you. Bye. Now, thank you. Now is the turn of Matteo Satta from Missile Moulineaux, if I'm not wrong. Are you ready, Matteo?
Yes, I am.
Okay.
Coming up.
So I see your initials, and now it's coming. Yes. Okay. Your face.
Sorry, I'm trying to find just. It's here.
Okay, it's coming.
Do you see the presentation?
It is coming. Viewing Matteo's application. I see. Yes, it is on the. Yes, it is. You can start.
Is it full screen? Okay. Sorry,
no, it's not. It's not full screen. No.
It's coming. It's coming. Hello, first, as just giving the time to my presentation to or my notebook to get available. I'm here to explain a completely different experience according to the one that Robin just explained. I think it's humbler. Sorry. my notebook.
We see a gray screen.
Yeah, that's what I see too. That's my problem. My laptop, of course, decided to start making a strike in the best moment.
You can go back to the previous visualization of the PowerPoint and
Oh,
not
if you
full
want,
screen.
I can show your presentation. I have it.
If you want to do so, yeah, why not? But here I don't see my
Okay, it's coming. Okay, now it's municipal. This one, Matteo, ici les Moulineaux.
Matteo, stop
Yeah.
sharing your desktop.
yeah. So,
Vista.
here now I'm good normally. It's working.
It's working now? Okay.
Yeah, it's working. Normally you should see. Do you see
Yeah.
it?
Yeah. It's okay. You can start.
Okay, perfect. Okay, for the ones that do not know Issy Moulineaux, I see a lot of let's start again. For the ones that do not know Issy Moulineaux is just really close to Paris. We're like a few kilometers from Paris. Then we have like somehow a situation that is similar, if not exactly the same, of Paris. And just as a first point, I'd like just to share with you how the lockdown was managed in France, because I'm not sure that everyone knows. I'll let you read, of course, but we have a kind of hard lockdown, the ones that kind of that happen in some countries, like I see a lot of Italians, like in Italy. And then we will start reopening from May 11. Now we are like a week after Italy. Just to give you also an idea, to get then to what we did, is that in our region, a point that is really important is that we have really high density of population, a really high use of transports, but we have a quite low average age. Let's say that we have 2 points that are somehow points to be well taken into consideration in this period in particular. But we have an advantage having a lower age, of course, is good now, as we know that COVID is nicer with if you're young. Okay, what we did, okay, see strategy, most of you start knowing. We're a city that normally works a lot on digital technologies to help use. Then we are not like technology centric, we're more user centric. And we do this to allow some good use. In this moment, of course, digital technologies are at the heart of uses. And the most important thing for us is to try to help people not to leave their houses. Also because, as I said, we have a big density of population. Then even just people going to buy some food may create situations that can be evaluated as a bit dangerous or spread the virus around. Then, and of course, next to this, you have to help them with the ones for schools, because I mean they have kids home. The parent becomes teacher. I know something about that. It's not that easy at all. And then you have to spend a lot of time. We're not used to have so much time to spend, and in particular to have so much time to spend home. Let's say that a couple of numbers, but we will see this later too. We have like a big increase of uses of social networks and the website. Then first here you have a nice picture on how in the front of a supermarket in normal weekday, it's starting having like these big lines. That's what we want to avoid. And then we tried to use data in an easy and humble way, no apps to create something like that, to help people reducing travels in the city. Then how to avoid them to leave home. Then we had first, and this was kind of old way fashion way of detecting information, the commerce department started calling the stores to know if they were open. Second, we try to understand which one of them used to do deliveries. And these, again, same people doing the same job. Then we centralized all the information collected in open data. This was done by CNID and then by myself and the colleagues in this period. And then we worked on creating a Facebook group to allow a participation of people and stores at the same time to crowdsource information and to create information. Then the process was quite easy. We collected the data, that's what they explained. We created 3 data sets. We published the data, and then through the Facebook group, we had fed the open data. And then we could, now the commerce service can update. Then we had like, I agree with Robin, in this period, we had a good collaboration with the commerce, and it's not always the case. Then we have, like, as I said, 3 available datasets. But what happened? We had 3 datasets. You see on the left, the Facebook, at the screen, the Facebook group in which you have an interaction. Really, you have the stores proposing their services and people answering. This is crucial because you have some stores that are not really stores. These are the people that sell you in the markets. I mean, the open markets around, not the supermarket. And those people are crucial. People used to buy from them. They can have better food, by the way. And you need to support them too, because otherwise these people don't sell anything anymore. All the data detected becomes 2 maps. We have one open stores and the other one is about deliveries, and a table. These are the markets, the people of the markets. Then we have like an interaction between the citizens, the stores, and then the city somehow in the middle of them. What we had as results, we had more than 130 services, stores that applied, let's say. And let's say that for food, it's difficult to give a percentage, but we are about 70, 80, 90%. We have a big part of the primary goods that participated. We had like plus 70% on use on social networks, as I said. That means are interacting with us much more. And then we have the open data portal that sees an increase. This is the increase. Then we have more, almost 3 times the use of open data portal, according to the same data, the same timing, a month and a half before the crisis and in the first month and a half during the crisis. And we have more than 200% on use of the website. That means that our digital technology is much more used. Then to go, and here it's really humble, but or at least it's really easy if we want to do so. We had, let's say, 3 main problems. First one, some families do not really have ITs, or at least they don't have IT that is adapted for the use to help their kids to get educated and to be in contact with their teachers, or they have too many kids and not enough notebooks according to the kids. And then we provided to 36 families some IT to help them keep in touch with their teachers. And that's, I don't know if you heard, but in France we will reopen schools also because we have some areas, that's not the case of Sicily-Molino, in which you have 40% of kids that are not in touch anymore with their teachers. Then you have to suggest activities to families. In this case, we had like workshops, I mean, of course, webinars, let's say, to help parents to educate their kids according to, I mean, talking about school in particular. And then at the end, also some tips, because people are home, they're a bit lost. As a city, your role is also to back them up. And then also to help them to structure, for example, giving structure their time home, explaining them kids don't have to wake up at 10. Kids need to have a kind of daily routine. This is an example, but there are things like that. And then at the end, spending time. Spending time may be a bit, say, much more useless to say, but it's not. And here you have, again, less or more the same structure. You provide activities like cooking or origami or whatever. You involve kids in that. and then you try to keep creating a community, because the community is what you risk to lose in periods like that. I don't know, it happens in a lot of countries, people at the that from their window starting yelling at someone because the person is outside or stuff like that. That's dangerous. And then we have some people that are on the ground, in particularly the health people. And then what we did is to give visibility to some people that, for example, associations that created masks for free for the people that are in health, or we made a kind of drawing hackathon for kids, sending the drawing on Facebook again to support the health people that are really struggling. I mean, that's not just in France, it's all over the world. Those people are really doing things that are incredible and maybe need support, and it's easy to do. But Facebook was really a good way to get all those, and we have a big album. Here you have a couple of examples, but we could have a lot of them. Do you hear me?
Yeah. It's
okay.
Okay.
That's good.
Merci, Matteo. Questions or comments to Matteo?
I have a question. I seem to understand that the open data was very much used in the first part regarding the connection between citizens and delivery and commerce. But did you do something like that also in the part regarding activities with families, kids, for example, solidarity, in order to, let's say, prepare some open data set that can be reused and that can constitute a good knowledge basis even in the future?
No, and I explain you why. Okay, let's say open data portal that was useful for creating maps and everything I've showed there. It's important. For, as an example, the other activities, this is stored on the website. The website has a dedicated section, and the dedicated section stores all that. Then somehow it's open data, but it's not the technical open data, because these kind of activities or things that are happening are news in some cases, like the one that I was saying about people making masks. That's news. This is not really useful for the future. And other activities like the drawing. On Facebook, you have an album in which people can access and can go to see, but there is really few interest in having an open data set in the terms of something reusable, because it's actually not that usable. I mean, the drawing for the kids is more for helping people. But what we did try to push on open data was really on something that can have a geolocalization first. That's important. Or for someone that one day, I mean, it's really, really simple, is one day I need to buy some food. With those lists, those maps, I can go to look for what kind of food I want first, because you have also some restaurants in there. That's one thing. But if I need to buy, I don't know, the salad, I will have the addresses of the people. I have the conditions, because in some cases they deliver some days, not other days, I don't know, in some time. You can call them or write them and take this. I mean, this is not something that happens just in Issy-les-Moulineaux. In France, it happens, it's not Issy-les-Moulineaux. And it's like 2 months that I'm buying my food like that. I'm not leaving home to buy food anymore. And I'm not buying from Auchan, Carrefour. No, I'm buying from local people because I'm supporting them like that. And at the same time, then it's a win-win situation. The city is helping the services and people. Because for us, really, here, 20,000 people per square kilometers is really big. We have crowds for nothing, and we have to avoid crowds. Then how to do? Stay home, come to you. And now we are thinking in trying to make this something that will still continue later. It's not just we are trying, understanding that maybe something that COVID or not COVID can be useful even in the future. And this is, I think, the most interesting thing.
Yes, this is because we were discussing about this point with Paolo some days ago, because we were thinking of doing something like this in Prato as well. And for example, on several newspapers, they publish some maps regarding shops available and things like that. But the point is that they're not really open data. There's just a sort of a visual information, while I was thinking that it would be really important for the city to have some data set, reusable data set on this point. And so I think this is an interesting activity you did. Yeah, thanks.
We can say you have a double advantage. One, you are helpful to people, and somehow there is also marketing, a good marketing point, in the sense that we had like a lot of also newspapers that took this information and spread the news around. And then for me internally also, it was good to work with some colleagues. We were obliged to do so, and that was good. I mean, we worked under pressure, of course, in urgency, with difficulties of every kind. But we understood that it was working because there was a problem with the link of the data sets. We had some interruption of the service of half an hour. In that half an hour, we had a lot of people writing us saying, "Where is your map?" And we said, "Okay, it's working." Okay, if they yell at us, it's working.
Okay, but Paolo, yes, please. And then there is, yes, please.
It's very simple. In the last slide, you also mentioned that you did something concerning the getting visibility to solidarity or things like that. Can you explain better what did you provide for the third sector?
What we provided to the third sector, you mean what we provided for solidarity?
In the last slide you mentioned, and the last point, that you are giving more visibility to solidarity. What do you mean with that?
Let's say that like the usual situation, we're distributing masks. Let's say we are starting distributing masks or stuff like that. But next to that, what we try to do is to put forward the people that were doing something related to solidarity. That means here in France at 8 in the evening, normally people cheers from the windows, for the health people. And we, as an example, did a few. In some cases, we published some people doing music from their window, or to have people making the masks for free. We made a video through the population to give visibility to people, to give the right credits to the people that are doing something good for their community, to inspire
Matteo,
yes.
Matteo, I thank you. I think we should leave the floor to the next ones. Thank you so much, but we will have time before. Last but not least, we will have a very interesting presentation from Tricala, from Cristina. But Cristina, before you go to that, Paolo, can you give the floor to Raffaele Guerreri? He wants to say something about data, which could be interesting. Raffaele, you can push on the microphone if you want, and you can talk.
Yes, thank you very much, George. Good afternoon to all of you. As far as
Raffaele is from Rome, by the way. Yes, please.
Thank you so much. As far as data collection and more in general, data-driven decision, especially during this period of time, I would like to share with colleagues a project which currently is ongoing, and is related to the development of a city data platform as a sort of data lake to collect data from one side internally from all our ERPs, and at the same time also from external sources of information. And we started to develop this collection of data in the previous month for mapping the development of businesses in our cities. But during this time window, we had the chance to have free access to data from mobile phone operator. And this was very useful to examine movements of people in the city during that lockdown in order to have an immediate and clear understanding of which were the most critical areas, or for example, which was the compliance of citizens to the national and local direction in terms of restrictions. And step by step, we started to increase this kind of integration of data even much faster than we thought and we could plan in the past, of course, because now we are also interested in collaboration with the Agency for Mobility. And so we are also adding another layer in terms of mobility. And in the same time, we had a proposal from a private partner to have an experimentation in terms of an app to let the people signal episodes of gatherings or danger or waste spreading inappropriately. So the idea is, again, to collect this data inside the city data platform, and together with other information, create some heat maps and to provide this kind of services to any kind of application of app, of smartphone app available on the city. So the idea is to have a direct feedback to the citizen of this kind of data through heat maps. So without any kind of individual in processing, but a sort of just collection and algorithm that mix data sources and provide an immediate understanding of some kind of phenomenon. Of course, we are
Raffaele, I suggest the following, if I may. I think this is a very relevant topic. Data. I've got many inputs from many people, so I will organize a special webinar on that. I will ask Vienna, of course, to participate, to you if you agree, and to others, and then decide. Well, understand what we are doing really, and go a little bit more in detail on what kind of applications you are really extracting from it. And then, okay, I will organize that. Okay.
Thank you so much.
Thank you. So now it's the turn for Christina. Are you still there, Christina? I'm sure you are. Yes.
Yes, I'm trying to share my PowerPoint presentation right now.
Okay. So I must say I was very impressed by what Tricala is doing, and so I hope you will have the same impression. We see your chart. Okay, it's okay.
It's okay?
You can start. Yeah, we can start. Thank you, Christina.
Thank you.
We may say a few words about Tricala. Maybe not everybody knows.
Yes, of course, I will start. So, hello, my name is Christina Karaberi. I represent the Greek city of Trikala, and today I will mostly speak about Activate's a telecare solution that we use to support our citizens during the COVID-19 lockdown. Just a brief update on the Greek status. So far, we have 2,566 confirmed cases, 138 mortalities, and luckily in Trikala so far, we have 0 confirmed cases and 0 mortality. Small city.
Congratulations, we invite you.
Let us hope we will continue this way. Let us hope about this. So Trikala is a city located in central Greece, in the region of Thessaly. We have a population of 80,000 people. I can say we are quite near the biggest cities of Greece, like Athens or Thessaloniki, just 3 hours by car from Athens, 2 hours and 10 minutes from Thessaloniki. At the same time, Trikala is considered a smart city, a city of digital innovation with long experience in IT innovations, and the city has been acknowledged globally as a smart city since 2010 and has been working for many years in close cooperation with its own developmental company, Trikala, where I work and I also represent today. Ever since 2008, which was the year that Trikala emerged within the municipality of Trikala, we have been creating novel infrastructures and providing services via ICT-based applications, focusing mainly on the improvement of all citizens' everyday life. We have a wide experience in successfully implementing EU co-funded projects, both as coordinators and as partners in areas such as mobility, culture, education, health, care, and governance. Many of these projects have brought to the city global acknowledgement and, most importantly, have familiarized the citizens with the uses of new technologies. One of these projects that we have recently participated in is Activate, the one I will present today. Activate is an Horizon 2020 funded project, an initiative aiming to create 5,000 smart homes around Europe, focusing on meeting the challenges posed by the aging of the population. There were 9 different pilot sites in 7 different European countries. One of them was Greece. The budget of this project was 25 million euros and more than 50 partners were involved. The main objective of the project was to prolong and support the independent living of older people in their own environments, to respond to real needs of caregivers, service providers, and public authorities, to deploy innovative and user-friendly large-scale pilots across all those 9 deployment sites, to create the first European interoperable and open ecosystem by reusing existing IoT platforms and technologies and not creating new ones, to assess the socioeconomic impact of all those services and to create new business models. In total, there were 9 different use cases implemented and tested across all those deployment sites. In Greece, we used the following use cases: integrated care for chronic conditions, daily activity monitoring at home, emergency trigger, prevention of social isolation, safety, comfort and security at home, support of transportation and mobility. Particularly, in our Greek pilot, we tested 2 different services during 2020. The first one had to do with us to create and monitor 150 smart homes for lonely yet moderate active elderly in 10 different municipalities across Greece. All this effort was done under the coordination of Trikala and the municipality of Trikala. The second service was implemented with the collaboration of the University Hospital of Thessaly. It was an integrated telecare service that supported chronic patients with diabetes. Those patients were provided with devices that allowed them to check their own sugar blood pressure and send their measurements to their dedicated doctor without visiting the hospital. Currently, there are more than 100 patients still enrolled to this service. You can see our control room where we can monitor all the houses across Greece, and just a close-up of the sensors and the devices used for both services. So for the smart homes, we used sensing devices such as door, window, cupboard opening sensors, motion sensors, beacons, smoke detectors, emergency triggers like panic buttons. Each house was monitored on a daily basis from the control room. Our personnel was able to monitor and support the elderly and address an emergency. For instance, if an elderly pressed the panic button and asked for help, open the door in the middle of the night and never close it back, or even show no movement inside the house for a day or 2. Those things, for instance, are emergencies that we had to address. In many cases, the caregivers, meaning the relatives of the elderly, who did not live at the same house but yet were feeling responsible for them, were also able to access those alarms and notifications and monitor the houses via an email service 24 hours a day. So both our personnel from the control room and the relatives were able to monitor the lonely elderly's daily life. For the second service, about the telecare service for the diabetic patients, we gave them medical devices that measured remotely the blood pressure and the blood glucose level. In collaboration with the University Hospital of Larissa, there was a dedicated nurse there responsible for recruiting the patients, training them how to use the devices, and monitoring their measurements before forwarding them to their dedicated doctors. Both those services were implemented for a year, as I said, and the pilots were actually completed. In fact, just before the lockdown, our technicians had already uninstalled all the equipment from all the houses, and the final evaluation of the project was in process. So we had in front of us the pandemic, constantly asking people not to visit elderly and constantly saying to elderly not to go outside or visit the hospital. And at the same time, we had all this equipment just sitting in our offices, knowing that they can actually support us forwarding this kind of movement restriction to our citizens. We therefore issued a press release offering these Activate services once more, free of charge, asking people to enroll. We also created a helpful line that people could call if they had any questions about this, and we made some announcements to the local media. There was an immediate response, and I dare to say I think it was the first time that we actually used telecare services under such demanding and realistic conditions. The challenges we faced during this were few. The first challenge was to promote the service widely during the lockdown. You can understand we couldn't have any info days or workshops during the lockdown, so we used mostly the local media and the municipal social services that we know have an extensive network and actually know what kind of people in our community could actually benefit from those services. Another challenge was to explain those services remotely to the elderly. During the real pilot of the Activates, we used to spend some time at an elderly's house to explain them how the sensors work or how the devices work. That was out of the question during the lockdown, so everything had to be done via the phone. Luckily, one of the characteristics of the Activate smart environment is that all sensors and devices are not intrusive, acquire very limited interaction, and therefore are easy to understand and to use. That helped us with another challenge, which was how to install the systems while keeping face-to-face meetings with the elderly is limited. Usually it takes 1 or 2 hours to create a smart home and adjust all the sensors. In order to minimize those visits to the elderly, we actually adjust all the devices and the system in advance in our own offices and just go there for 50 minutes or 20 minutes to create a smart house. Of course, by wearing masks and gloves during that meeting. And the last challenge we had actually was how to overcome the technical problems that may occur. We had technical problems during the actual pilot of the project, and therefore have already created a protocol with the most common problems and how to overcome them in advance. So there wasn't an issue there all the time. So in other words, Activates, although completed and fully deployed before COVID-19, it turned out to be a very practical and effective service during this pandemic. It gave us a more realistic pilot the last month. I would also like to mention some other initiatives that the municipality took during the lockdown in order to support the most vulnerable ones in our community. So during the lockdown, the municipality reopened the night shelter for the homeless people, conducts daily distribution for feed beneficiaries. Actually, more than 2,500 people have a door-to-door service with goods and necessities. The municipality also offers food on a daily basis to different places and parks around the city for stray dogs and cats. And why is this? It's because the elderly have a habit to go outside and feed stray dogs and cats. In order to prevent this, the municipality has created some hotspots with food for the stray pets, for the stray dogs and cats around the city. And in addition, they have created an online service for people that need to be hospitalized and own a pet and have nobody to take care of it. You can go online and find a volunteer to do this for you. There is also a hotline at the community center for psychological support and counseling to our citizens in order to confront the negative impact of the COVID-19. There are some microsites created inside the official city's website. The first one contains very helpful information and phone numbers and IT services that a citizen can use in order to contact any business they have with the municipality instead of actually visiting the organization. There is another microsite with many creativity activities like recreational activities for children, gymnastic proposals, books, videos, for different kind of activities for all the family that must stay at home. You just put one of these 3 buttons I have in this down here, and you can have some ideas about reading, sports, or other activities. Lastly, the municipality had to work very closely with Trikala in order to support our refugee population. Ever since 2017, we have a refugee population residing in Trikala. Trikala actually responsible for supporting these people in terms of accommodation and social integration. Many of these refugees are people with many vulnerabilities and serious medical issues. So we had to create a daily yet remote communication channel with them and make sure that they were kept informed in relation to movement restrictions, new legislation due to COVID-19, or all the operational changes happening in hospitals and schools. We also distributed leaflets in their mother language for safety and protection rules, created a helpline in Arabic and Sorani because those people specifically didn't have the time to learn Greek. And we are currently conducting daily phone communication with all the refugee families on a daily basis, as I said, in order to make sure that they stay home and that they are safe. So that was my presentation. Thank you.
Thank you, Christina. Now it's open to questions or comments or similar experiences. Hello, friends.
Can I ask you, Christina, about the Activage project? It was just in the phase of piloting the things, so it was okay for COVID-19 by chance, which was the relation between the emergency and the project?
The project had completed its official pilot just when the lockdown began. So the pilot was during 2019-2020. We had just uninstalled everything, and then the lockdown came. And we knew that this kind of system could actually serve during the lockdown, and we said let's use it once more for real for real this time.
A very true pilot, this one.
So is it something that? So I understand there is a platform related to this project, and then there is some that can be reused by anybody, and then of course there should be assistance and a control center. What is reusable elsewhere?
The idea of Activate is not to test new services, but to take existing technologies and telecare services that have been implemented in the past and make them interact in an interoperable and open environment. So the Activates platform can adjust any kind of service. So if another city, for instance, in another country wishes to create a smart home like ours, they can actually address us or the CERT, who is our technical partner here in Greece, and who can provide them information about the platform. They can even actually use the platform and even adjust their own services in the existing smart home of Activate. You can adjust any kind of service on this environment and create another service, more integrated, depending on the needs.
Mm-hmm.
Christina, in this pandemic situation, who was in the back office? I mean, who was assisting remotely people in need? Did you have agreement with hospitals, let's say, or local doctors, or other groups?
In relation to the Activate.
Yeah, I mean, when you started this, let's say, pilot, but in the real context of the COVID.
The control room was the same that we had on Activate. It was our Trikala personnel responsible for monitoring the houses, and the relatives of the elderly also had the ability to have access to the sensors and to the notifications. And for the diabetic people, we had to change from the initial pilot. Now, the elderly wanted to use this device at home and measure their blood sugar pressure. We will contact with their own private doctor and gave him the access of those measurements. Because at the actual Activate pilot, it was the hospital of the university hospital that were monitoring these measurements. But now, in this real-time pilot, it was the private doctors responsible for each patient that was able to monitor their measurements.
Claudio wants to, maybe you want to say what you just said. You just wrote on the chat. Claudio, maybe take your microphone. Could you hear me, Claudio?
I think he has left.
No?
He said
He
goodbye
said,
in the,
he said goodbye.
in the
Okay.
message.
Okay, goodbye and good luck. Okay. Anything else? Now, I have some other questions. Well, first of all, if I understand well, well, in Italy, for instance, the healthcare is regional, and while the social assistance is local, and so it is the city to organize that. I understand in Tricala you have been able to integrate all that in one single service, right, Christina?
About Activates, yes, Activates contains both health services and social services, but not in such an extensive level about social services, because it doesn't provide any kind of psychological support or something like this. It actually monitors an elderly's life and makes sure that everything's okay.
Okay, and what is the acceptance from both the people, the elderly people, and on the other side, the service people and the families of what is you have now implemented?
For the actual pilot that lasted 1 year, we are now currently finishing the final evaluation, and everything will be uploaded on the Activates Evidence Open database. Mm-hmm. So we're waiting to see the results, but I think that will be very positive. And for during the lockdown, it was quite positive. As I said at the beginning, the citizens of Trikala have been familiarized with technologies. We have done a lot of experiments here with different kind of IT services. They're usually very enthusiastic in using this kind of services.
Mm-hmm, mm-hmm. And you are planning to deploy it further later on?
One thing that hasn't been completed yet about Activates is the scale-up scenario, meaning that some of the services conducted in other regions of Europe, the non-use case I mentioned in the beginning, will be given to us, and we will give them some of our own services, and we'll try to recreate the whole environment with new services. So this, unfortunately, could not be done now due to lockdown. It has taken an extension, and we will continue with this, I think, in September.
Now, my question was really also related to the fact that usually, as you somehow mentioned it, when the European project stops, everything is forgotten. Now, I understand that because of your experience now during the pandemic, you are going to, the city itself is going to push on it and develop it further, right?
Mm-hmm. Mm-hmm. Activates is one of the things that we would like to continue having after the pilot, the whole project ends. And I think the municipality of Pilar-Hortiati, which is in Thessaloniki and is also implemented Activates and has some smart homes in the city, has already decided to fund the Activates to continue after the project ends. So it remains to us, the municipality, to find the budget and continue having it, because it has proven its use.
And what was the average effort to organize and support all that? Is it something you can do in short time? Do you need a lot of dedicated people to watch about the results of it and the control room and so on? How does it more or less give us an idea of what kind of organization you have behind that?
For the lockdown pilot, let's call it the lockdown pilot, it was easy because it was in our city. All we had to do is go local on the local media and address the municipality social care personnel that know people that in need, know the elderly, and provide us with potential users. It was 1 or 2 days work. We already had the control room. We already know how to install the houses and use the devices. But for the real pilot, the Activates pilot before the lockdown, because we implemented those houses not just in Tripoli, but in 10 different municipalities across Greece, it was huge. I had to, for instance, to supervise more than 7 to 8 health personnel in other cities that I have never met, by phone in order to make sure that they recruit the right people and they know how to install the houses, because everything had to be done at the same time in different places in Greece. It was more challenging. But just to implement it here in Trikala, it was easier.
But this was the cities around Greece. You mean during the COVID
No.
period?
During the Activate pilot, we implemented those 150 smart homes, not just in Trikala, but in other cities as well. But we were responsible for this. That was quite challenging.
and then, do you know if the other cities are doing as you are doing in developing further now during this period? Have you got information about it?
I think Thessaloniki has done something similar, but for the other cities, no.
Mm-hmm. Well, it would be interesting if this can be easily replicated and used elsewhere. Okay, any other question? So Nadira, you enjoyed the session. I have to leave. Bye bye, Nadira. Raffaele, the same. And Claudio, the same. Any other question? No. So now let me say just a few words before we leave. You will get all the handouts and the links that I have to what was said about Vienna. There is no handout, and you will get the registration that of the whole session. You can listen to it again. Please answer to the survey I will send you by tomorrow morning. And as I said at the beginning, I need speakers for the different topics. I know there is interest now about data, and I will go back to that. But for security, I would like really to have somebody apart from Paolo who is willing to share his hacking experiences. Would be very interesting. But maybe I think security is one of the key issues when you have remote workers. How do you guarantee that everything works like in the office and you don't have data breaches or hackers spoiling your whole system? So please send me your if you want to be candidate to talk about it, I will be very pleased to take it. Thank you. And I will announce soon the next webinar when I have enough speakers for it. Thank you so much.
Thank you.
Thank you. Bye-bye.
Bye-bye, everybody.
Bye.
Thank you. Bye-bye.
Ciao. Paolo, puoi rimanere un attimo? And Glyn, can you stay a moment?